Hello, I'm Kate Marie from Slow Aging, and I'm here today with Kathy Gallagher to explore anti-wrinkle injections. These are also known as neurotoxin injections, or commonly as Botox. Mind you, there's a lot more on the market now than just Botox, but doctors aren't allowed to talk about this. But today, we're going to explore how these anti-wrinkle injections work and why you would do them. Kathy, thanks for joining us. Kathy, I'm really interested to know the ins and outs of anti-wrinkle injections and to discuss the differences between the different brands and how long they last. So tell me a bit about anti-wrinkle injections. How do they work?
Anti-wrinkle injections, they work on a muscle, so they're injected into a muscle specifically, and the area of the muscle that they attach to is called the neuromuscular junction. And this is where the nerve would normally come and stimulate the muscle to contract. So it's blocking that action and the muscle can't contract. So it causes relaxation of that muscle, lasting about 3 to 4 months. It takes about that long for the neuromuscular junction to be shed along with the anti-wrinkle injection, and the treatment wears off.
So in terms of my appearance, so it's very important that we inject the right muscle. And so tell me a little bit about that, because some people are a bit confused. I know when I talk to people about injections, they think that they're going to get Botox in their lips, for example, and they get that confused with fillers. So talk about where you use anti-wrinkle injections. And I've used Botox generically but I know that there are other brands out there, which we'll get to.
Yes. Well, we're looking at where are the muscles that are creating negative facial lines. So typically we see lines in the frown area, these vertical lines, sometimes a horizontal one here, and then sometimes there are horizontal lines across the top of the forehead, and then there are little fine lines here at the side of the eyes called crow's feet lines. They're the very common areas that we use these anti-wrinkle injections. So we're trying to inject the product into the muscle that is creating the line. So we need to know exactly which muscles are creating the line, and we need to know exactly where that's happening and what depth that needs to be injected into. So it's not going to fill the line, that's a different thing. It's just going to relax the muscle that is squeezing too hard and creating that line.
Yeah, and I think the thing about these injections, it's not really just about younger you or making you more beautiful. Like in my family, we all have what we call very fondly the family gutter. And it's this big thing, this dint in the forehead. And my son's 18, he's starting to get it as well. And it's a bit disconcerting because you look like you're really cross all the time and it just gets worse and worse. And I've used it to prevent that from forming. So it's good for prevention, isn't it?
Well, definitely. I mean, often we just need to look at our mothers or our parents to get some impression of what sort of things are going to happen to our faces as we get older. And certainly if we can see a tendency for lines like that to develop, it's a very good time to step in and prevent that from happening. Treating a frown line is a very common thing, and as you mentioned, it can occur very early, and often people in their 20s have a deep frown line that's very, not just unattractive, but it's giving out a very negative impression to other people. It's suggesting that you're angry when you're not angry. So it's a common area to treat, to give a more relaxed and open, welcoming sort of expression.
The other thing on my mind is people shop for anti-wrinkle injections on price. And I think there's a real danger in that, because from my experience, and particularly working with you in the past, some doctors are really, they're artists almost. So it's not just about jabbing the needle into the right muscle. It can be used very subtly to get some shapes. Explain about how that works.
Well, you do need a very good knowledge of facial anatomy, and you need to know obviously about how the muscles work, and you need to know too that they're not always exactly the same for everyone. So that's essential. And then you need to know what you're trying to achieve with the injections, whether you're trying to achieve a subtle lift in the brow, whether you're just trying to get rid of a line in particular, and to know what muscles are negatively impacting the face without touching the other muscles that you need to preserve. So it's about doing this in a very balanced way. A lot of this does come from experience, because yes, you can teach formulas and yes, you can get it right a lot of the time, but if you haven't seen the results of thousands of patients coming back, then you don't realise all the possible things that can happen and outcomes that can happen. So a lot of it does come down to experience and artistically knowing what will give the best outcomes.
We're in Australia, I know from a practitioner perspective, you're not allowed to promote any one particular product over another, which I think is a bit dangerous. It's, we used to always refer to it as Botox, I did when I first started having Botox. But now I understand there's a number of other products. I think there's Xeomin, there's Botox and Dysport. So what are the differences between these products and what do consumers need to know?
The products are not identical. I think it's important to know that. They're not formulated in an identical way. They are all botulinum toxin, so they are all basically made from the same thing, but they are not necessarily equivalent when it comes unit for unit. Xeomin and Botox are both equivalent with unit per unit. Dysport is 2.5 units approximately equals 1 Botox unit. So you do need 2.5 times as many units with Dysport to equal the same dose with Botox. There are other subtle variations in how they work, and different practitioners have preferences for different products. My preference is Botox, and a lot of the research that we've had over the last 25, 30 years is based on Botox and the way it works, and a lot of the safety data and the big studies have used Botox, and I feel that we can be a lot more confident with that particular product.
So talking of safety data, what are the things that can go wrong with, it's called a neurotoxin, so how toxic is it?
It's a highly purified protein derived from the botulinum toxin, and it's a very safe thing to administer. It's been around for a long time and it's used in many other medical applications. For example, in people with cerebral palsy, it helps to relax contracted muscles, certainly in much, much higher doses than we would ever use for the smaller facial muscles. It's used very commonly and now very mainstream to use for an overactive bladder. And there are many other applications. So it's used extensively and there's a lot of data on the safety. But there's a few little minor side effects that can occur with incorrect placement of the product. And that's more to do with the local effects. If product moves from the injected muscle into an adjacent muscle, or if it's injected into the wrong muscle, you can have an adverse reaction because of its effect on a different muscle. And that could result in, for example, a heavy eyelid or a heavy brow, which is not what you're wanting, of course. Sometimes people may get a bruise from the treatment. That's short-lived, it's a minor thing, it goes away. And sometimes people can get a headache from the treatment. Again, that's short-lived, and generally, if people are prone to tension or migraine headaches, they may even get some improvement from a regular Botox or anti-wrinkle injection treatment in the forehead.
Okay, so tell me about other areas of the face. I've noticed it can be used to lift a bit of the sides of the lips. I think as you get older, your lips will drop a little bit. You can look a bit sour.
There's a lot of little...
And neck. The other thing, platysmal bands.
Botox is registered for use in the areas I've talked about, but it's certainly used in other areas. It's off-label use of Botox, but it's very commonly done. So the muscles that pull the corner of the mouth down, we can weaken that so that the mouth corners don't turn down and give the mouth a sad look. That's a simple thing. We can use it to relax the bands in the neck that can stand out and look quite aging. So it just relaxes those muscles, and even along the jawline to make the jawline look a little bit more defined.
What are the sort of questions I would ask if I'm new to having Botox or, an anti-wrinkle injection?
I think you want to be aware of that doctor's experience in the field. I think that's important, and how regularly they perform these treatments, what type of training they've had. I think that they're important questions. I think that people that do these treatments all the time on a daily basis and are very comfortable with them, you're far better going to someone like that than somebody that does a little bit of Botox on the side. I think that, you know, there are dangers that that person may not keep up with as much training. So I think you really want to know the experience and expertise of the doctor, whether they're affiliated with any cosmetic colleges. Also, I think you want to know about what products they're using. You know, I think most people need that information.
Oh, thanks, Kathy. That was really helpful.
That's okay.